Cheers. And welcome to Wine Wednesday. This week we're going to be talking about what to expect your physical therapy to be like after your rotator cuff repair.
So most of the surgeons will have you start with approximately 6 weeks worth of passive range of motion, meaning that you are not allowed to actively move your arm at all. Someone else needs to assist you. So that's one of the things that we work on in physical therapy, is just passively moving your arm around, along with activating the other muscles of the shoulder girdle in order to prepare your body for when you are able to move that shoulder. After that, we go into about another 6 weeks of active assisted range of motion, where again, we are assisting you. You're starting to do those movements. We are assisting you, or you are assisting yourself in order to do it before we can actually move into the active range of motion, real strengthening phase.
Do you guys do any of your manual therapy techniques on a rotator cuff patient while they're in treatment during those beginning weeks?
Yes.
Okay.
A lot of times we have to address different soft tissue adhesions that might be occurring because of the surgery, or even just some stiffness and tightness on the other side or up into the neck.
Or that may have occurred before surgery.
Right.
That because of muscle guarding, which is simply muscles tightening and shortening to prevent you from moving because it hurts. So we often mobilize the lats, the trapezii muscles of the shoulder girdle, even the biceps. They all can become tight and limit mobility in the shoulder after surgery as much as they did before surgery. So we'll address that as well.
Okay. All right. I guess I can ask also, is the manual therapy technique something that you'd experience in all physical therapy clinics, or is that something that you'd have to actively search for?
You should expect some degree of it. The question is to what extent, and what is actually addressed.
Okay.
So there's a wide range of that. We look at everything that attaches the body to the torso and to the muscles of the arm as well. And we also address thoracic spine mobility, because that's directly impacted or impacts the mobility of the shoulder, and of course the neck.
Okay. Well, cheers.
Cheers.
Cheers.